Greetings to graduates, families, friends, alumni, and colleagues. Dr. Crystal Edwards, the Associate Dean for Career Development, and I, Dr. Kenneth Payne, the Associate Dean for Professional Development, would like to welcome you to the Texas Tech Health Sciences Center Jerry H. Hodge School of Pharmacy Graduation Award Ceremony. While this ceremony is always an emotional time, it is even more emotional this year as the class of 2021 has overcome unique challenges.
That's right, Dr. Payne. The end of your P3 year included the transition to Zoom didactic classes. Yes, I said the word Zoom. I'm so sorry for all your flashbacks. You are no longer able to attend classes with your peers, but instead had to find an area in your home to convert to a Zoom studio. Then there were not only remote exams, but also rotations. I mean, what are remote rotations and how do those work? Well, you not only figured that out, but met those challenges head on and thrived to prepare for your P4 year. You also quickly learned what it meant to lose your face-to-face support system. Gone was studying together, hugs and smiles in person with family, friends, and others who supported you. You learned to adapt to virtual relationships with your peers, faculties, and preceptors. Downtime was different and often decreased as all learned to adjust to this new pandemic world. For some, this meant new hobbies like cooking, sewing, online games, and many other fun adventures and skills. If you had planned vacations, those were canceled, and you replaced them with things either locally or in your home. Professional meetings to network and see new sites were now all virtual, and challenges of presenting posters was a new struggle. Along with this were school events where you got together with people from across and within the campuses, leadership retreat, career fair, IPE events, and mentoring meetings. How to virtually interview for job, residency, and fellowships became a new skill for you. And my gosh, the Dallas construction challenges. But you did it, and you learned what it meant to be a professional in a virtual world and how to still network and grow. You made connections, and you have obtained jobs, residencies, and fellowships to start the next chapter in your life.
As a result of all of these changes, many of you dealt with a whole new level of fatigue and mental strain. Self care habits were difficult to initiate and maintain, only adding to the difficulty of adjusting to a new school experience. One of the most intimidating courses in the curriculum, Grand Rounds, was delivered as a hybrid. And while some of you may have preferred delivering a 40-minute presentation via Zoom, others did not. In Amarillo, several students jumped in to assist with VTM compounding and labeling. Students on all campuses volunteered to assist with COVID-19 testing and vaccinations, fulfilling a vital role in public health. Our students have always prioritized giving back to their community, and this year was no exception. Each of these challenges have been difficult, but they have elevated you beyond the usual graduate. Over the last year, you have grown as a person and as a professional. You have experienced increased vulnerability with your peers and preceptors, demonstrated grit and flexibility, and as a result, you are a more robust pharmacist. This video will recognize just a few of those students who display leadership within our school and the profession of pharmacy. Unfortunately, there are not enough awards or time to speak about each student individually, but know that we, the faculty and staff, think each of you deserve to be recognized and applauded.
I couldn't agree with you more, Dr. Payne. Today, we want to honor a few of those graduates who have helped lead the pharmacy profession forward while they have been in school. Recipients of the fourth year professional awards are chosen by the Progressions Committee based upon recommendations from faculty, preceptors, and fellow students. Please enjoy these video presentations announcing our 2021 award winners, and be sure to join us live at the graduation festivities tomorrow, May 22nd in Amarillo, to hear the winners of the Bowl of Hygeia, Banner Bear, Hannah Thompson Perseverance Award, Beatrice Excellence in Pharmacy Award, and the Texas Tech Superior Patient Care Award. Thank you.
Good day and welcome to the Texas Tech University Health Sciences Center Jerry H. Hodge School of Pharmacy 2021 Commencement Award Ceremony. I have the honor of awarding the Award of Excellence in Clinical Communication sponsored by Wolters Kluwer. My name is Dr. Mark Hossie. I'm an associate professor in the pharmacy practice department, and my patient care area is pediatrics. And this student that I will be awarding this prize to was on my rotation, and this student was able to provide very strong care to multiple pediatric teams during the week, often in the same day. This required very good communication skills. She had to monitor patients covered by several different teams and several different attending physicians, and she was able to work well with all of them, including the different residents, students, nurses, etc. And the students showed good aptitude for communication with patients and caregivers also. Other faculty noted very similar things in that she had a strong desire for advanced clinical communication skills. She was also able to help other students in their clinical activities, which is a very big plus. She's organized and clear in patient presentations and identified important interventions that needed to be made and presented those in a professional and clear manner. She completed projects that highlighted not only her strong verbal communication, but written as well. As another faculty member noted, when they wrote a manuscript together, that her writing skills were very polished for someone at her stage in her career. And her peers also noted that her communication skills are very, very good, that she excels in many areas, but particularly in communication. And one student noted that this student is a fantastic counselor and always seems to be able to explain things to whatever level of experience that recipient needs, so they understand the information as well as possible. She has excellent professional writing skills as well. So it is my pleasure to award the Excellence in Clinical Communication to Anna Safrey. So congratulations, Dr. Safrey, and we appreciate your efforts here these past 4 years, and we wish you all the best moving forward.
Kaylee Ferris came to our rotation January the 4th, 2021 at the TTU HSC Pharmacy, right after we got our COVID vaccine. We were the first pharmacy in town to get the vaccine, and she helped us as we began giving the shots. She handled the stress like a champ. Her bedside manner with patients was so caring, and technique was stellar. During her rotation, we gave approximately 1,200 COVID shots. She gave shots to my own family, and they have asked about her multiple times because of her caring nature. She has a servant's heart, and it showed in every interaction. I watched her living the TTU HSC values of beyond service and integrity. I am so proud to present the Excellence in Community Practice Award to Kaylee Ferris.
Hi, I'm Dr. Higbee, and it is my pleasure to present the first Texas Tech Jerry H. Hodge School of Pharmacy Ambulatory Care Graduation Award. This award recognizes a student who demonstrates a high degree of excellence and commitment to the practice of ambulatory care pharmacy. First, I would like to say this is the most kind-hearted and sincere student I've ever worked with, and why it should come to no surprise at why he provides excellent patient care. I have had the privilege of precepting this student on his ambulatory care rotation both in his P3 and P4 year at UT Southwestern Family Medicine Clinic, where he provided direct patient care 3 to 4 days a week, and it was extremely rewarding to watch him grow and thrive from his P3 to P4 year. He absorbed knowledge like a sponge through every patient encounter and topic discussion he participated in. His P3 Journal Club was on insulin pumps versus multiple daily injection regimens in patients with type 1 diabetes, after we saw a patient in clinic who was recently diagnosed with type 1 diabetes who we were helping to manage. It was very well presented with a thorough handout and generated engaging discussion amongst attendees. Overall, he did a great job on his P3 rotation, and as he came to clinic every day ready to learn and help the team in patient care. However, it wasn't until his P4 rotation where he really shined. Although this took place during the COVID pandemic, he was still able to see patients in both clinic through telehealth appointments as well. This was great for him because he loved talking with and helping patients with their care for chronic disease management. He went from being a shy P3 to jumping in on day one to provide excellent communication and education to patients. He particularly got good at smoking cessation and providing motivational interviewing. He also helped provide excellent care to patients with diabetes, hyperlipidemia, hypertension, and patients on anticoagulation. He continued to grow with more patients he encountered, applying feedback, participating in topic discussions, and self-study guides in various projects. He also attended various COVID webinars as well as an interprofessional education virtual event on resiliency. One project he worked on has been extremely helpful in quickly educating patients on injectable diabetes medications with handouts both in English and in Spanish. Due to his friendly and professional demeanor, he quickly built a rapport with the healthcare team of physicians, residents, nurses, and medical assistants. With his eagerness to help and his hard work ethic, the team quickly started to trust him and ask him medication questions. He had effective patient interactions, guideline-based recommendation, and accepts and implements feedback. He is very professional with great skills of teamwork, communication, work ethic, and professionalism. He will be starting his residency in July, and I look forward to the great things he will accomplish as a future practitioner. So without further ado, please join me in congratulating Edward Mercer on receiving the School of Pharmacy Ambulatory Care Award. Congrats, Ed.
Hi, my name is Trista Bailey, and I have the opportunity to announce the winner of the Award for Excellence in Geriatrics for 2021. The Division of Geriatrics sponsors an award for a graduating pharmacy student. The award recognizes a student who demonstrates a high degree of excellence and commitment to the practice of geriatrics. This is what the nominator had to say of the candidate. I don't say this lightly, but this student is one of the smartest, brightest, and naturally clinically minded students I have ever taught in my years of teaching. While I was not his main preceptor for his geriatrics rotation, I was involved in topic discussion and conducted his final oral presentation. He scored very high on his final and even brought up things the exam writer didn't mention in the key. I also borrowed him to help out with several things at my practice site. He was able to complete the tasks I asked him to do with little guidance and based on his clinical skills. This student is also co-authoring a case report to be published in the next few months that he volunteered to help with just because he wanted the experience and thought the case was cool. Clinical problem solving is definitely one of his strengths. However, what has stuck with me the most wasn't exactly a patient interaction, but something that occurred during his P3 geriatrics elective. During his elective, this student was tasked to meet with a community-dwelling older adult to ask about their experiences in healthcare, then write a reflective paper. The particular older adult I assigned him to was actually an old family friend that I keep in close contact. She told me that this student was so kind and courteous during the interview. Soon after the interview, there was a big ice storm and the city shut down. The student called to check on her to see if she or her sisters needed anything. In fact, one of the sisters did need something, so the student went over there to help her and delivered a hot meal after. This student takes notice and cares for others in a way that even I am inspired by. He is truly a servant. This student plans on staying local and working in the community or hospital where he will continue to make an impact on patient care wherever he serves. Please join me in congratulating Blake Hawley for winning the Award for Excellence in Geriatrics this year.
Congrats, Blake.
Way to go, Blake. Congratulations.
Hey, Blake, congratulations on winning the Geriatrics Award. I wish you all the best with your future.
Congratulations, Blake.
Congratulations on a well-deserved honor.
Congrats, Blake.
Oh, hey, I didn't see you walk in there, but I'm glad you're here because I wanted to tell you that you rock and congratulations. Now let's jam out.
Congratulations, Blake. I am so proud of you. Hang in there. Keep on keeping on. This is Nelda Rollins. Hello to Sarah. Bye-bye.
Hi, I'm Dr. Higbee, and it is my pleasure to present the Community Outreach Award of Excellence. This award is designed to recognize a student that has demonstrated exceptional service to patients and the community. I cannot say enough wonderful things about this student and her passion for community outreach. This student was appointed to be a student pharmacy manager at one of the Dallas Interprofessional Student-Run Free Clinics at the beginning of 2020, in which she stepped into the role as a natural leader and team player. However, when the COVID pandemic hit and the student-run free clinics closed, she was eager to find other ways to reach out to the community and provide education. She took the lead on a virtual naloxone project with myself, a physician assistant, nurse practitioner, 2 other pharmacy students, and a medical student. She helped team develop a pre-post survey and deliver the virtual training presentation. The project was QIRB approved and results were presented at the Virtual Society of Student-Run Free Clinic National Conference. Narcan, the nasal version of naloxone, was also donated to the free clinics, and we are working on a publication. In addition, the student also took the lead on a couple presentations requested by medical students, including med reconciliation, med resources, and smoking cessation. Before COVID, she also participated in every community volunteer event or health fair opportunity possible. She's even planned 7 health fairs and has provided immunizations in over 8 different settings. She's provided asthma education to students at 3 different elementary schools when she was in Amarillo, as well as volunteer in the community clinics there. She's volunteered in over 13 non-clinical community events as well. She's done all this while remaining the top 25 in her class and holding leadership positions in multiple student organizations. Due to her vast community outreach, she was also awarded the National Community Pharmacists Association Officer of the Year Award in May 2018. With this student's hard work and dedication in the community during pharmacy school, I believe her to be an excellent candidate and my honor to present Z Kong with the 2021 Texas Tech Jerry H. Hodge School of Pharmacy Community Outreach Award of Excellence. Congrats, Z, you deserve it.
We are so proud of each of you for your hard work and perseverance. We would like to also acknowledge that behind each successful graduate stands a village of supporters. In addition to your classmates, your family and friends have shared your tough times and your wins throughout the last 4 years. Thank you to all of the parents, grandparents, family members, spouses, children, and significant others who have stood by our graduates these last 4 years.
I also want to say thank you to all the students, especially the student organizations and government leaders, for being innovative and continuing to lead and engage one another. These are the things everyone will remember: pies in the face, cook-offs, gaming together online, watching Netflix and chilling out virtually, along with so many other things you did together. Thank you all for continuing to provide patient care as well. During this pandemic, there were many challenges that you faced. You made a difference in the life of someone who may have struggled to get help or just was thankful to see or hear a friendly voice. Thank you all for joining us, and congratulations, class of 2021.